Good afternoon, all. So, this is week 8 fabrication technique for man-space sensor clinical perspective. This is the problem-solving session. So, let's start the session. I'm Arpita Biswas, a PhD scholar in electrical engineering department from IIT Jodhpur. So, this is more details about me. So let us start the session. This is question 1. The following statement is related to experimental results that were discussed for the antibiotic susceptibility testing microfluidic chip. So the statement is upon the addition of the antibiotic drug to the microfluidic chip containing the captured bacteria, the normalized impedance decrease. So is this statement true or false? The question is, the following statement is related to the experimental results that are discussed for the antibiotic susceptibility testing microfluidic chip. So the statement is, upon additional of the antibiotic drug to the microfluidic chip containing the captured bacteria, the normalized impedance decreased. So is the above statement is true or false? So the statement is true. So the right answer is option A. So next move toward the question number 2. A microheater is included in the drug screening device. The purpose of the same is, the first option is at elevated temperature sensitivity increase. Second option is to maintain the normal human temperature. And the third option is matrizer is stable only the elevated temperature 320 Kelvin. And the fourth option is all of the above. So go through the question carefully and try to give the right answer. The microheater is included in the drug screening device. The purpose of the same is, first option is at elevated temperature, sensitivity increase. Second option is to maintain the normal human temperature. The third option is material is stable only at elevated temperature, 320 Kelvin. And the fourth option is all of the above. So, what is the right answer? Yes, the right answer is option B, to maintain the normal human temperature. Okay, the normal human temperature is 37 degrees centigrade. To maintain this temperature, a microheater is included in the drug sensing device, drug screening device. Okay, so next move toward the question number 3. For determination of a drug efficacy, microfluidic devices are preferable to static systems because, so first option is in microfluidic devices, drugs can react to tissue easily. The second option is human body is a dynamic system and microfluidic devices can replicate it. And the third option is both static devices and microfluidic devices give the same result. So both are equivalent. And the fourth option is microfluidic devices are cheaper than static systems. So go through the question carefully and find out the right answer. To determination of drug efficacy, microfluidic devices are preferable to a static system because in microfluidic devices, drugs can react to tissue easily. The second option is human body is a dynamic system and microfluidic devices can replicate it. The third option is both a static system and microfluidic devices give the same result, so both are equivalent. And the fourth option is microfluidic devices are cheaper than the static device. So the correct answer is option B. Human body is a dynamic system and microfluidic devices can replicate it. Okay, so the right answer is option B. So next move toward the question number 4. Evaluate whether the following statement is true or false. So the statement is matricelle is a material used in microfluidic devices to mimic the extracellular matrix of their tissues. So is the statement is true or false? So what is the right answer? Matricelle is a material used in microfluidic devices to mimic the extracellular matrix of the tissues. So this statement is true. Okay. So next move toward the question number 5. Consider the following statement related to the microfluidic chip for rapid drug screening that was discussed. So first statement is the substrate is used as a wafer, and the second statement is the electrical sensor. Interdigited electrode was patterned after the depositing a layer of silicon dioxide on top of a nickel nichrome microheater. Which of the above statement are true? So the first option is one only, and the second option is option the statement two. The third option is neither one or nor two, and the fourth option is both one and two. So go through the question carefully and find out the right answer.
अर्पिता मैंने ज्वाइन कर लिया है।
The right option. So the right option is option B. Only the statement two is right. So the electrical sensor interdigited electrode was patterned after depositing the layer of silicon dioxide on top of the nichrome microheater, which was the above statement are true. So next move toward the question number 6. Consider the following statement related to the microfluidic chip for rapid drug screening that was discovered. So first statement is the substrate used was a silicon wafer, and second statement is the electrical sensor interdigited electrode was patterned after depositing the layer of oxide on top of the nichrome heater. Which of the above statement are true? First option is the photoresist coating, then soft bake at 363 Kelvin, then UV exposure, and then development. And next process the hard bake at 393 Kelvin. And the second option is photoresist coating soft bake at 338 Kelvin UV exposure and then development hard bake at 368 Kelvin. The third option is photoresist coating soft bake 338 Kelvin UV exposure hard bake at 368 Kelvin development. And the fourth option is photoresist coating, soft bake at 363 Kelvin, UV exposure, hard bake at 393 Kelvin, and next process is the development. So go through the option carefully and then try to get the right answer. So the right option is option C. First, photoresist coating, soft bake at 338 Kelvin, then UV exposure, hard bake, 368 Kelvin, then development. Because in the drug screening devices, they are use the SU8, SU8 negative photoresist. That's why at first they have done the hard bake at 368 Kelvin, and then they have go through the development process. Okay, so the right option is option C. So next, move toward the question number 7. PDMS belongs to the group of materials commonly referred to as the silicons in fabrication of the microfluidic devices. So PDMS can be used generally. The PDMS is patterned by which the lithography technique. So first option is the optical lithography. Second option is the E-beam lithography. The third option is the soft lithography, and fourth option is the all of the above. So go through the question carefully and find out the right answer. So what is the right answer? So the right option is the soft lithography. Okay. The PDMS is patterned by which lithography technique? It is soft lithography. So next move toward the question number 8. In the microfluidic chip for rapid antibiotic susceptibility testing that you have seen in the lecture. So the antibody was used for what purpose? So first option is to capture the antibiotic when they are introduced. And the second option is to capture the bacteria from the sample. A third option is to ensure the better bacterial growth during the incubation after adding the antibiotic drug. And the fourth option is to enhance the killing of the bacteria by the drug. So, what is the right option? In the microfluidic chip for rapid antibiotic susceptibility testing that you have seen in the lecture, the antibiotic was used for the purpose. So first option is to capture the antibiotics when they are introduced. The second option is to capture the bacteria from the sample. The third option is to ensure the better bacterial growth during the incubation after adding the antibiotic drugs. The fourth option is to enhance the killing of the bacteria by the drug. The right option is capture the bacteria from the sample. So option B is the right answer. So next move toward the question number 9. In vivo situation of our body can be mimicked most faithfully by first option is idea structure. Second option is the microtubules with the peristaltic pump. And the third option is the microfluidic chip. And the fourth option is all of these can individually can mimic. So what is the right answer? So the right option is the microfluidic chip. So next move toward the question number 10. A microheater is fabricated on the silicon wafer followed by the deposition on insulation layer. A metal layer is deposited and it patterned to get an IDA structure. The fabrication process of this device is a dash mask process. So first option is the 1, second option is the 2, and third option is 3, and the fourth option is it is user dependent and cannot be predicted. So go through the option carefully and find out the right answer. What is the right answer? The right option is the option C, 3. Okay. So next move to the question number 11. What is the main advantage of using a patient-centric platform for drug screening in cancer treatment? So first option is the reduces drug side effects. The second option is the shorten the recovery time, and third option is the determines the most effective drug for each patient, and the fourth option is increases the drug availability. So go through the option and find out the right answer. What is the right answer? What is the main advantage of using the patient-centric platform for drug screening in cancer treatment? So first option is the reduces the drug side effect. The second option is the shorten the recovery time. Third option is the determine the most effective drug for each patient. And the fourth option is the increases the drug availability. So the right option is option C. Determine the most effective drug for each patient. Okay. So next move toward the question number 12. What is the biopsy used in a cancer treatment? So first option is to remove the tumor entirely. The second option is to screen the drugs for the patient. And the third option is to collect the tissue sample for further testing. And the fourth option is to administer drugs into the tissue. So find out the right answer. So the right answer is option C, to collect the tissue sample for further testing. Okay. So next move toward the question number 13. Which of the following is a limitation of using the static platform for drug screening? The first option is it is expensive to build. The second option is it does not mimic the dynamic nature of the human body. The third option is it requires a long time to get results. And the fourth option is it cannot be used for a chemotherapy. To find out the right option. Which of the following is a limitation of using this static platform for drug screening? The right option is it does not mimic the dynamic nature of the human body. Okay. So next move toward the question number 14. What material is mentioned as being used to fabricate the channels of the microfluidic chip? The first option is the silicon, second is the gold, and third option is PDMS, and fourth is the titanium. So which one is the right option? What material is mentioned as being used to fabricate the channel of the microfluidic chip? The right option is option C, the PDMS. Okay, so PDMS is used for the channel of the microfluidic chip. The channel of the microfluidic chip. Okay. So next move toward the question number 15. What is the role of the microheater in the microfluidic chip? The first option is to supply the power to the electrode. The second option is to maintain the temperature of 37 degrees centigrade for cell survival. And the third option is to generate the impedance readings. And the fourth option is to measure the concentration. So what is the role of the microheater in the microfluidic chip? To supply the power to the electrode. The second option is to maintain the temperature of a 37-degree for cell survival. And option C is to generate the impedance readings. And option D is to measure the drug concentration. So the right option is option B, to maintain a temperature of 37 degree for cell survival. So next move toward the question number 16. What is the purpose of creating a hole in PDMS during the microfabrication process? First option is to allow the light to pass through it. And the second option is to create an electrical connection. And the third option is for flowing the drug and loading the cancer cell. And the fourth option is to enable the UV exposure. Try to find out the right answer. So the right option is option C, for flowing the drug and loading the cancer cell. So what is the purpose of creating the hole in the PDMS during the microfabrication process? So for flowing the drugs and loading the cancer cell. Okay. So next move toward the question number 17. What happens to the impedance when cancer cell die during the drug effectiveness? So first option is impedance increases, and the second option is impedance remain the same, and third option is impedance decreases, and the fourth option is impedance fluctuates. So what is the right answer? So the question is, what happened to the impedance when cancer cell die due to the drug effectiveness? So what change occurred? So the right option is option C, impedance decreases. Okay. So next move toward the question number 18. What is the difference in the impedance behavior between the drug tolerant and drug susceptible cells? Okay. So first option is drug tolerant cells show the higher impedance changes than the drug susceptible cells. The second option is drug susceptible cells show the less impedance change than drug tolerant cell. And the third option is drug tolerant cells show the less impedance change than the drug susceptible cell. And the fourth option is there is no difference in impedance behavior. So what is the right answer? The right answer is option C. Drug tolerant cells show less impedance change than drug susceptible cells. Okay. So next move toward the question number 19. What frequency was found to be optimal for measuring the impedance shape in cancer cell? First option is the 500 Hz, second option is the 1000 Hz, and third option is the 1500 Hz, and the last option is 2000 Hz. So what is the right answer? What frequency was found to be optimal for measuring the impedance shift in cancer cell? The right option is option B, the 1000 hertz. Okay. So next move toward the question number 20. What type of drug is commonly used to treat the breast cancer cell and melanoma? First option is the platinum-based drug. The second option is the textual-based drug. And third option is the chemotherapy. And the fourth option is the radiation therapy. The right option is platinum-based drug. Okay. So next move toward the question number 21. What is the role of matrixyl in experiment? So first option to kill the cancer cell and second option is to mimic the extracellular matrix surrounding the tumor and the third option is to flow the drugs through the chip and the fourth option is to measure the impedance changes. So what is the right answer? So the right option is option B. To mimic the extracellular matrix surrounding the tumor. Okay. So next move toward the question number 22. Which color represent the drug tolerant cell in melanoma? So first option is red, the second option is blue, The third option is green, and the fourth option is yellow. So the right answer is option B, blue. Okay. So next move toward the question number 23. What happened to the cell conductivity when cell died? So first is the conductivity decreases. First is the impedance increases. The third option is the conductivity increases, and the fourth option is cell becomes more resistant. So what is the right answer? The right option is conductivity increases. Okay. So next move toward the question number 24. What type of cancer cell are most resistant to paclitated cell? So first is the melanoma cell, second is the prostate cancer cell, third is the breast cancer cell, and the fourth one is the lung cancer cell. So option B is the right answer, the prostate cancer cell. So next move toward the question number 25. What is the primary use of a microfluidic platform discussed in the lecture? So first option is to measure the drug concentration. The second option is to test the cancer cell viability. And the third option is to screen the efficacy of different drugs. The fourth option is to detect the number of dead cells. The right option is option C, to screen the efficacy of different drugs. Okay. So next move toward the question number 26. Which bacteria is commonly associated with the urinary tract infection? The first option is the stra- Staphylococcus aureus, and the second option is the E. coli, and the third option is the MRSA, and the fourth option is the Streptococcus. So what is the right answer? So the right option is option B, E. coli. Okay. So next move toward the question number 27. What is the current gold standard technique for testing the bacterial antibiotic susceptibility? First option is the PCR testing. The second option is the disk diffusion technique. And the third option is the genetic sequencing. And the fourth option is the mass spectrometry. So the right option is option B, the disk diffusion technique. So next move toward the question number 28. What does MIC stand for the context of the antibiotic testing? First option is the maximum infection control. The second option is the minimum inhibitory concentration. The third option is the microbial infection count. And the fourth option is the maximum inhibitory concentration. What is the right answer? So the right option is minimum inhibitory concentration. The option B is the right answer. Okay. So next move toward the question number 29. What is the rapid testing for antibiotic resistance critical for neonates? So first option is they can handle the multiple antibiotics better. The second option is their immune system is not as strong as adult and waiting for 2-3 days can be fatal. And the third option is they are more resistant to antibiotics than adult. And the fourth option is neonates generally don't require antibiotics. So go through the question carefully and try to find out the right answer. So wait for a minute. I'm coming back in 1 minute. So what is the right answer? So option B is the right answer. Their immune system is not as strong as adult, and waiting for 2 3 days can be fatal. Okay. So next move toward the question number 30. In the lecture, what type of technology is suggested to rapidly capture and test the bacterial resistance to antibiotics? The first option is the centrifugation. The second option is the genetic engineering. The third option is the microfluidic technology. And the fourth option is the X-ray crystallography. So find out the right answer. So microfluidic technology is the right answer, option C. Okay. So next move toward the question number 31. In the described device, what is the function of the integrated heater? So first option is to melt the plastic substrate. Second option is to maintain the bacteria at 37 degrees centigrade for culturing. And the third option is to kill the bacteria. And the fourth option is to sterilize the microfluidic channel. So what is the right answer? So option B is the right answer to maintain the bacteria at 37 degree for culturing. Okay. So next move to the question number 32. What is the role of antibodies in the microfluidic based antibiotics testing device? So first option is they act as a dye for detecting the bacterial growth. And the second option is they capture the bacteria through the affinity based sensing. And the third option is they kill the bacteria in the samples. And the fourth option is they serve as a growth medium for the bacteria. So the right option is they capture the bacteria through the affinity based sensing. Okay. So next move to the question number 33. What method was used to fabricate the heater in the described device? So first option is the thermal evaporation, and the second option is the screen printing, and third option is the chemical vapor deposition, and the fourth option is the electroplating. So in the lecture, which process they have used to fabricate the heater? So the right option is option B. They have used the screen printing process for fabricate the heater. So next move to the question number 34. What material is used to create the channel in the microfluidic device? So first option is the silicon, second is the PMMA, the and the third option is the copper, and fourth option is the glass. So what material is used to create the channel in the microfluidic devices? So the right option is option D, the PMMA. Okay. So next move to the question number 35. How are antibodies immobilized on the chip for bacterial capture? First option is the through the covalent bonding, and the second option is using the affinity-based sensing. The third option is using the electrical current, and the fourth option is by applying the heat. So the right answer is option B, the using the affinity-based sensing. Okay. So next move toward the question number 36. What is used to age the silicon dioxide during the fabrication process? So first is the hydrochloric acid, second is the nitric acid, then the third option is buffer hydrofluoric acid, and the fourth option is the sulfuric acid. So which one is the right answer? The right answer is the BHF, the buffer hydrofluoric acid. Okay. So next move to the question number 37. What is the next step after curing the PDMS in the microfluidic chip fabrication process? First option is the deposit the interdigited electrode. The second option is the strip of PDMS from the silicon mold. And the third option is the etch the silicon of dioxide again. And the fourth option is the apply the oxygen plasma. So the right option is option B. Strip off the PDMS from the silicon mold. Okay. So next move toward the question number 38. Which bonding technique is used to bond the PDMS with the glass in the microfluidic chip? First option is the adhesive bonding. The second option is the thermal bonding. And the third option is the oxygen plasma bonding. And last option is the ultrasonic welding. So which one is the right answer? The right option is option C, oxygen plasma bonding. Okay. So next move to the question number 39. How long is the impedance measurement taken after loading the antibiotic in the microfluidic chip? So first option is the 15 minutes, second is the 1 hour, then 2 hour or 3 hour. How long is the impedance measurement taken after loading the antibiotic in the microfluidic chip? So the right option is 1 hour. Option B is the right answer. Okay. So next, this is the last question. This question number 40. What is the advantage of using the microfluidic bacterial detection and antibiotic susceptibility test? The first option is the large sample volume required. The second option is the rapid measurement and a small sample volume. And the third option is the high cost and complexity. And the last option is the slower detection time. So which one is the right option? So the right option is option D, rapid measurement and a small sample volume. So we are ending the session here. Next we meet next Tuesday, 7 to 9 p.m. Okay.